Now for the next bone which we are going to look at is importance. That's trying to establish reasons why we study the bone. It's a nasal bone. So what are the reasons why we study the nasal bone? So let's have this. Let's quickly have it. So this is a nasal bone, and it's basically the bone of the nose. So sometimes traumas to the face could affect it. Like all these boxers, very common. Wrestlers is very common. Also people that have all these contact sports is very common. So we'll be looking at the fractures. We'll be looking at deviation, or also be looking at rhinoplasty. Okay, where they do surgery to reshape the nose, sometimes to correct a deformity, sometimes just for cosmetic reasons. So it's small, but it's very clinically insignificant because it forms a bridge of the nose, which contributes to facial aesthetics. Like how your face is looking is greatly influenced by how this bone is. So let's look at it. First, you could have fractures just like this. So breaks in the nasal bone, most commonly fractured facial bone, because it's kind of like one of the most toughest. So causes could be sports injuries, could be assault where somebody beat you up, could be falls, could be road traffic accidents. But the clinical symptoms is pain, swelling, and you are bleeding through the nose. There's a visible deformity or flattening of the nasal bridge, and there's difficulties of you breathing due to obstruction. So complication, it could lead to septal hematoma, chronic nasal obstruction, cosmetic deformity. Your face could just change, you understand? Okay. The nasal deviation. So deviation or displacement is misalignment of the nasal bone or septum, probably after the trauma, or some people are born this way. Do you understand? Sometimes it could be that a lot of injury occurred here, so the bone just, But sometimes some people are born this way. So clinical features, it could lead to obstruction of your breathing. Yes. It could lead to recurrent sinus infections. Then cosmetic deformity. You have a crooked nose. You don't like the way your nose look like. So even a little deviation would completely change how you look. Okay. So rhinoplasty or septoplasty. Rhinoplasty is just a cosmetic surgery to reshape the nose. Often involves nasal bone repositioning or reduction, while septoplasty is a surgery to correct septal deviation. Okay. Improving airflow. So nasal deviation or septal deviation is still the same thing. Okay. So that's it. The importance of it is it provides structural support for nasal shape. Then of course, if you want to manipulate anything here, you have to have good understanding of the anatomy of the nasal bone. Then any complications could lead to persistent obstruction, asymmetry. That's two sides are not the same, and also need for a surgery to be done again.